So for us, attracting and retaining primary care physicians in particular has been a challenge.
Primary care.
Yep. Family medicine,
internal
medicine, especially internal medicine.
Can you quantify that for me?
When we did a gap analysis a couple of years ago, we were probably 5 or 6 physicians short, and that's if you included advanced practice providers and others. 2 or 3 years ago, as I was getting started, we almost paused labor and delivery, caused a lot of angst, had a number of physicians that ended up leaving the community or retiring a little bit earlier than maybe they would have otherwise. And that exacerbated that gap. And recruiting to a rural community, it's not like you just say, hey, we have vacancy at a hotel, come on in, or, job wanted. And so we've worked really hard to create a plan to fill that gap. And
so a lot of people make plans. What is your plan and what are you doing?
Yeah. So what we've done and what we continue to do is really, when we invite somebody to come out, we want them to be a good fit for the community for a long haul. And so we make sure they come out for 2 or 3 or 4 days. We invite their family to come with them. And as a hospital administrative team, we spend maybe half a day with them.
Yeah.
Usually we're trying to get that family or people out with those in the community that they will live and work with for the rest of their career. They get to see the schools or go out on the trails or, we've had retired providers or physicians, school administrators, local elected officials just come out and spend time with people.
So you're involving, how do you go about getting civic leaders, non-hospital folks engaged in that process?
Yeah. So early on, when we started sharing that was what we wanted to do to attract and recruit people, we had a group of concerned individuals in the community that said, what can we do to help? And one of the first things we asked them to do was to start helping us create an inventory, a list of people in the community that would really want to help and support the hospital.
Nice.
And each one of those individuals, not only did they say, hey, here's my name and my phone number, they said, here's the list of activities I like. This is my family size. This is the age of my kids, or I'm retired. And they committed that when we would call and say, hey, we've got a like family or a like individual coming, would you spend time with them? And created that level of commitment. And so it's almost like we played matchmaker. When someone comes out, we match their family with somebody in the community or an activity that they like with somebody in the community.
Are you talking recruiting? Or are you talking, what about perpetually? How do you go about assimilating that family into the community?
Yeah, so that relationship then gets extended.
Okay.
So once somebody's recruited and they're in the community, we end up connecting them with 2 different almost mentors. One is a peer on our medical staff, and the other is somebody in the community.
Okay.
And we make sure that both of those people are constantly checking in. We've had community members that then invite the physician and their family over to their home for dinner, spend some time with them, check in, connect them with others in the community.
Give me the best story that exemplifies this.
Oh, the best story is the first person we brought out. She was in residency and we got connected, and on the phone we said, what do you enjoy doing? She says, well, we love 4-wheeling. And so when she flew out, her and her husband met us at a little restaurant in this little neighboring town, and one of our staff has a side-by-side, and he arranged with the sheriff to take the side-by-side on the street, even though it's not street legal, and he met us at this little restaurant.
Wow.
We had a little bit of lunch, and then he took her husband up into the mountains on the side-by-side. Well, she got to go tour the hospital. Long story short, over the next couple of days, they got to enjoy some of those activities. We had a local retired caterer cater a meal at a physician's home. We got to sit out and watch the sunset.
Unbelievable.
We had another group of people take them out on a hike. Our kitchen prepared their lunch for them in backpacks, so they didn't have to worry about any of that. The kicker is on Sunday when they were getting ready to leave, the physician had yet to go out on the side-by-side, and she had said, gosh, could I go out one, and enjoy that? So our employee took them out again, and it had rained, and they kind of got a bunch of mud and everything. And so he brought them over to his home and said, look, shower and clean up here before you get on the plane. And so they invited him into the home, got him fed, got him cleaned up before they headed out of town. And when we called a little bit later and said, we'd like you to come out, you can imagine the answer was,
Great.
We'd love to be here. And we just repeated that time and time again.
Joe, thank you so much. Appreciate it.
Yeah. Thanks, Judson.
Yep.